Now let's go ahead and talk about some evidence-based treatments that can be used with people who are experiencing stress and anxiety. Now there are three commonly used evidence-based treatments for stress and anxiety. The first being medication, the second being psychotherapies, and the third being meditative therapies. Again, it is not within our scope to decide what our clients need for this. Rather, what I hope you gain from this section of the lecture are some coaching strategies that you can use with people who are experiencing stress and anxiety. So we know that as people who struggle with depression and or anxiety adopt healthy behaviors or health behaviors, monitoring how those behaviors impact their mood is really important, because when you monitor how health behaviors impact mood, you can see if any modifications need to occur to kind of continue with their plan and with progress. What we know about exercise and mood is that exercise actually usually feels good, but it also can feel bad in the moment, right? And it depends on how your client is viewing that. We also know that how exercise is making a client feel is a strong predictor of exercise adherence. So we know from science that people who have a high level of exercise enjoyment are also going to have a high level of exercise adherence. So it's critical that we understand a client's history with exercise so that we can help avoid or maybe even overcome some of past negative experiences with exercise and physical activity. And we can utilize self-monitoring tools to help guide intensity levels and even incorporate something like music or videos into the workout to help them improve their mood during exercise. We also know that for healthful eating, we want to help our clients find healthful eating practices because we want them to be able to stick with it over a long period of time. Again, staying within our scope, we aren't registered dietitians, we aren't nutritionists, so we need to be very careful about what we recommend for healthy eating. And so using some kind of general guidelines is always a good idea, but really making sure that it comes from them and asking what changes they can make in their diet and eating to make these changes for healthful eating. Now, frequent lapses can slow or halt weight loss and lead to frustration. And that's common and can affect people's feelings about anxiety and depression. Experiences of success with healthful eating and weight loss are likely to improve mood. So that's pretty common sense, right? If they're not doing well, if they're having lapses, that's going to make them feel frustrated. If they're feeling like they're seeing improvement, that's going to improve their mood. So here are some coaching strategies that you can use to help kind of monitor mood. They can change notably over a period of time, right? Because we know that people's moods does change over a period of time. And that can have some pretty immediate benefits and potentially even long-lasting benefits as well. So it's important that we encourage our clients to monitor their mood as they make these health behavior changes so we can see how impactful it is on their mood. And it's not just overall, it's behavior by behavior. So as they're tracking their mood, make sure that they're very specific. This behavior made me feel this way, this behavior made me feel this way, etc. And you're gonna see, if you can tie behaviors to mood, you're gonna see some clear indicators as far as why they're feeling what they're feeling, and then that will give you some insight into how you can make modifications. Goal setting is another coaching strategy, but you all know that already. And we can gauge how realistic a goal is based on their confidence level. So if you remember that confidence ruler of that 1 to 10 scale, that can be really helpful here, especially in changing someone's mood and potentially altering anxiety and depression. So setting very small goals can be helpful because that's more realistic for them to achieve. And remembering that goals should be increased gradually and not too quickly. And then another coaching strategy is positive reinforcement, making sure that it's coming off as genuine and not inauthentic, because that can be used as a credible metric of success. A lot of people will gauge how other people gauge them as a metric of success. So positive reinforcement can be really impactful to mood here. And it also defines metrics of success at the beginning of the relationship, so that can be helpful as well, right? So positive reinforcement is a great tool that you can use as a coach. And then social support. So collaboratively explore and incorporate this into your planning. So again, you're not sitting here saying this is what you need to do. You need to go find a workout buddy. You need to go meet a friend and talk about nutrition. It's more than that. It's what is going to work within their life, what's realistic, who can they rely on, what are the social networks around them and environmental networks around them that can help them. This is especially important as social withdrawal is common in people with depression and chronic stress. So essentially what this says is people who are experiencing any kind of anxiety or stress often will remove themselves from social situations. So if you can collaboratively work with your client to improve the time that they're spending and or increasing the time that they're spending with social support, particularly social support surrounding their health behaviors, that's going to be really impactful for their long-term behavior change. Another coaching strategy is dealing with negative thinking, because that's going to happen and is common with people who are experiencing anxiety and or depression. So explore what the client believes about their ability to develop a healthy lifestyle. That's important. See where their thought process is. And then challenge any negative beliefs with evidence. And don't just be positive, be realistic. And so I think that's the key thing here that's different from a health coach to a personal trainer or even a fitness instructor, because oftentimes the personal trainer and fitness instructor, they just come off all the time as just positive, positive, positive. Well, you can do it, you can do it, you can do it. Well, sometimes that's not just the answer. And sometimes while you can do it is nice, acknowledging where they're at, acknowledging their barriers, and maybe even some of their negative thoughts is going to be the thing that's going to help them set more of a realistic goal and challenge themselves some of those negative beliefs. So now let's talk about a term called distress tolerance. And this is one's perceived capacity to tolerate physical discomfort or emotional distress. So people with low distress tolerance are often respond by avoiding or stopping activity that caused it. So if you have a client who experiences distress of any sort, they are going to be, if they have a low distress tolerance, they're going to be more likely to relapse than someone who has a high distress tolerance. So distress tolerance is something that we really want to build in our clients. And so this can be kind of divided into two main categories. We have this acceptance-based strategies, which you have mindful awareness and acceptance of discomfort, but you also have commitment to values. And I'll go into that a little bit deeper now. So acceptance-based strategies are when we want to help people practice tolerating the discomfort that they experience, because that's going to happen in life. They're going to experience discomfort. So we're trying to help our clients tolerate some of that. One strategy to do that is through mindful awareness, which involves viewing discomfort as a kind of a subjective experience that eventually is going to subside. Okay, so mindful awareness is being aware that, okay, this is temporary and this is going to go away. Another strategy that's within this acceptance-based strategy is the acceptance of discomfort, which involves acknowledging discomfort when it's present, but understanding that it doesn't define the experience. Okay, this is happening, this doesn't define my life. This doesn't define this overall experience. So those are two types of the acceptance-based strategies. Now, commitment to values is a little bit different. This involves acknowledging that escaping discomfort is not more important than the values driving the lifestyle change. So that's where, again, knowing your client's values is so important. So in this case, the client can be asked to discuss the benefits of escaping the discomfort and the benefits of gain by sticking it out. So for example, what are the benefits of escaping the discomfort of physical activity? So you're sore a few days, you're not enjoying it right now, that's discomfort for your client. What are the benefits of escaping that discomfort versus the benefits of continuing to be physically active, continuing to lift weights? What's the end goal? So again, when you kind of ask them that question, they can kind of see, does my behavior align with my values? And is that worth escaping your discomfort? Or is escaping your discomfort or stopping that behavior worth not aligning your behaviors with your values? So let's go ahead and stop here and do a quick learning recap. First question is, how are exercise and mood related? The second question is, what are some coaching strategies to use with clients who experience depression or anxiety? And then lastly, what is enhancing distress tolerance, and what are the two primary strategies that you can use with your clients to help improve and enhance distress tolerance?